Hi, my name is Karen McKinley. This is my head and neck assessment video. I've already washed my hands before I gloved and cleaned my stethoscope with alcohol. So I introduce myself to my patient. My name is Karen. I'm going to be your nurse. I'm going to be performing an assessment of your head and neck today.
Okay.
I'm going to start with the head. Inspect the head. Observe the size, shape, and proportion to the rest of the body. The hair is thick and well distributed on the scalp. You pull the hair back and inspect the scalp. Look for any lesions, any lice, any swelling. Palpate the scalp for any masses, any tenderness. Does that hurt anywhere? No?
Nope.
Okay, move on to the face. As I'm talking and assessing the patient, I am observing the face for symmetry, both when he's talking to me and in at rest. The skin is warm and dry and intact. Check the face for tics, any excessive blinking. Then we'll test for cranial nerve number 5 is the sensation of touch to the face. So we'll start with soft. I want you to tell me if you can feel this on your face. Feel
Yep.
it there? Okay, how about here?
Yep.
And here?
Yep.
Okay, let's check this side.
Yep.
And here?
Yep.
And here?
Yep.
Okay, now we're going to do the little sharper end. You feel that?
Yes.
There?
Yes.
Here?
Yes.
Good. There?
Yes.
There?
Yes.
And there?
Yes.
Okay, those should be equal bilaterally. I'm going to palpate the jaw, the muscles of the jaw. Clench your teeth for me. You should feel the tension here in the jaw and then up here at the temples. Good. Okay, now cranial nerve number 7 is the muscles to the face. Raise your eyebrows. Clench your eyes shut. How about puff out your cheeks and show me your teeth? Good. Everything should be equal bilaterally, looking for symmetry in the face. Now the temporomandibular joint is here in front of the ears. Open your mouth for me and shut it. You're feeling here for any crepitus. Do you have any popping? Do you feel any popping when you do that?
No.
No? Do you have any pain when you do that?
No.
Good. Okay, now we'll move on to the neck. You observe the neck for symmetry. Let's see. Trachea is midline. Okay, and there's no jugular venous distension noticed. Turn your head down. You're going to palpate the processes of the cervical spine. And just feeling for anything abnormal, any swelling, the trapezius muscle here. Is that tender? Does that hurt anywhere?
No.
No. Okay, lift your head back up. I'm going to test the range of motion to your neck. We'll put your chin down to your chest. Good, and back up. Chin to your right shoulder. Chin to your left shoulder. Okay, and then back to normal. Now tilt your head to the right. And tilt your head to the left. Good. Does that hurt?
Nope.
You feel like any tightness or anything when you do that?
Nope.
Okay, now tilt your head back. Okay, there's no limitations noted to the range of motion in the neck. Cranial nerve number 11. We're going to test the trapezius muscle and the sternocleidomastoid. So I want you to shrug your shoulders. I'm going to push down. Push up against me.
Okay.
Good. Now turn your head to the left. Push against me there. So this is testing the sternocleidomastoid muscle there. And now push against this hand. Good. Okay, now we're going to listen for the pulses in your neck. Well, we're going to palpate first. I'm going to palpate the carotid pulses on both sides. It should be a 2+. 1+ is weak and 3+ is bounding. They should be equal on both sides. Now I'm going to listen. What I want you to do is take a deep breath in, deep breath out, and hold it. I'm going to listen with the bell of the stethoscope. Ready? Go. And hold it. You're listening for bruits. And I don't hear anything. Sounds good. Pulse is normal. Okay, now we're going to move on to the lymph nodes. We're going to start up here in front of the ear. What we're checking for is swelling or tenderness anywhere in the lymph nodes. We're going to start in the preauriculars right here. Then we'll move back to the posterior auriculars behind the ear above the mastoid. And then back to the occipitals in the back of the neck. The parotids at the angle of the jaw. The submandibulars between the angle of the jaw and the mandible. The submental midline under the mandible. Now we're going to check your thyroid. I'm going to give you a drink, but hold it in your mouth for just a minute. Now I want you to swallow. Observe the neck for swallowing. Do you have any trouble with that?
Nope.
No cough was noted when he swallowed. Let's do it one more time. Let me feel. Swallow. Okay. Good. All right. Now we'll go on to the eyes. The eyes, we're going to test cranial nerves 2, 3, 4, and 6, which are related to vision. Do you have any trouble with your vision?
Nope.
But you wear glasses, right?
Yes.
Okay. Okay, no double vision?
No, ma'am.
No blurry vision?
No, ma'am.
I mean, I guess probably normally with your glasses off it's a little blurry, but that's okay. Okay, I'm going to check the color of the eye. The scleras are white and clear. There's no redness, no drainage coming from the eye. I'm going to test the pupil dilation. Look right at me. Good. In here. Okay. Now, test accommodation. Ask the patient, I want you to focus on something on that back wall there. Okay. Don't focus on my finger until I tell you. Okay, now focus from there. Change it to my finger. Good. So the eyes move together and the pupils constricted to focus on my finger. So that has accommodation. I'm going to test the visual fields. So I want you to look straight ahead. I'm going to put my hands on either side of your face, and I want you to tell me from your peripheral vision when you can see my fingers moving, okay? Here we go.
Now.
Okay, and from up here?
No.
And down here?
No.
And they should be relatively the same, about the same point. So the pupils are equal, round, reactive to light, and accommodation. Move to the ears. The ears should be symmetrical bilaterally. The skin color should be similar to the rest of the face. You look inside the ear for any drainage, the presence of earwax, any lesions, any swelling, which he has none. I don't have an otoscope. If I did, I would check inside at the tympanic membrane. It should be flat and intact. And we have been having an interactive conversation, and that's testing cranial nerve number 8, which is hearing. His gross hearing is intact. So we'll move on to the nose. Cranial nerve number 1 is the olfactory, is the sense of smell. Let's have an alcohol wipe here. Can you smell this alcohol on there?
Yes.
Good.
Right from my face.
I'm sorry. Okay, we're going to inspect the nose for symmetry. We're going to test the patency of your nares, which means the ability of the air to go into and out of your nose. So I want you to use your finger and close one side. Now take a deep breath in and out. Good. Now the other side. And out. Good. Okay, I want you to tilt your head back. I'm going to push the nose back here and look inside. I'm checking inside for deviation or perforation of the septum and the condition of the nasal mucosa. It should be pink and moist. If there's any drainage, if there's yellow or green drainage, that indicates sinus infection. Pale membranes with clear drainage indicates allergies. So there's no drainage right now. You're not feeling sick or congested in there?
No.
Good. All right, let's check your sinuses. The frontal sinuses up here. Is there any tenderness there?
No.
Okay, maxillary here.
No.
Good. Okay, now we'll move on to the mouth. Examine the outside of the lips. We're looking for the color, the condition of the skin, the presence of any congenital defect like a cleft palate. Sorry. That's all right. Any ulcers or anything like that. So let's look inside your mouth. Okay. Now we're going to inspect. I'm going to retract the cheek and look at the condition of the oral mucosa. They are pink and moist. There's saliva there, no dry mouth. You just inspect the condition of the teeth. And look for any decay, any bleeding or swelling of the gums. The tongue should be pink and moist. The dorsal surface should be rough with a thin white coating. Touch the tongue to the top of your mouth. The underside should be glistening. You should be able to see veins. It should be smooth. Okay, now stick your tongue out. Good. Move it up, down, left, right. Okay, open again. Say ah.
Ah.
When they say ah, you observe the uvula. It should be midline without any deviation. Cranial nerves 9, 10, and 12 assess The movement of the palate and the gag reflex, which he swallowed earlier without any trouble. No coughing, no gagging was noted. Check for excessive drooling in the mouth, any canker sores, or anything like that. Is there any other trouble that you're having?
No, ma'am.
Okay, well that concludes our assessment. Thank you.
Bye.